we are going to start with...
So we are going to start with our first speaker, Mr. Sridhar Swarna from Sight Savers, and he will talk about how can scleral lenses change lives.
So we need to make proper timing, hopefully, because we are late and we have a next session next time, 12 o'clock. So we will be respecting the time, please.
So a consultant working for Sight Savers, which is my own practice based in Dubai. So today we are going to talk on scleral lenses. Like everyone must have attended a lot of scleral lens sessions where it has been discussed on how the scleral lenses can be fitted on mainly the keratoconus, this thing. So So it goes, fitting scleral lenses goes, beyond vision correction, and they are lifeline. These lenses are a lifeline for the patients with ocular surface diseases or dryness, and they can transform lives for the patients suffering from keratoconus, Stevens-Johnson syndrome, pemphigoid, Sjogren syndrome, and many ocular surface diseases. So it's not just about vision. They give ultimate comfort and confidence, and they help in restoring daily function of the patients. So what makes the scleral lenses unique? They are one of the the best lenses for keratoconus management. And with proper management with scleral lenses, a keratoconus patient may not require a corneal graft in his lifetime. So the best part is they don't, unlike the soft lenses or the corneal RGP lenses, they don't rest on the cornea. They vault on the vault over the cornea, and they create a fluid reservoir between the lens and the cornea that to mask the corneal irregularities, and they protect the epithelium from friction because there is a beautiful cushion of the fluid reservoir, and they keep the cornea continuously hydrated, and they provide ultimate smoothness and stability, and they can be used beautifully as therapeutic lenses or bandage lenses with built-in clarity. So the best part is, as you can see here, so they can be used as these lenses are to be filled always. Please remember that scleral lenses are to be filled with saline, and anything that you fill in the scleral lens, it has to be preservative free, because we are going to lock the fluid between the lens and the cornea. So any fluid that is locked between the cornea and the lens, if it is with preservative is a chemical that may cause unwanted toxicity to the cornea. So they can be combined with a lubricant or any medication, but make sure that they are all completely preservative free. They can work beautifully, for therapeutic purpose. Keratoconus, they are, for me, I've been practicing scleral lenses for more than 12 to 15 years, and they are my first choice, in managing keratoconus. And as you can see in the picture, the dark blue is the fluid reservoir, which acts as a cushion, and it masks the irregularities of the cornea, giving a crisp vision. And most importantly, they lock round the clock over the sclera, so it doesn't let the fluid to escape. So managing Stevens-Johnson syndrome, the challenges are, a lot of scarring and meibomian gland loss and chronic pain. The patient suffers a lot with SJS, which is an autoimmune disorder, and quite often the conventional therapy is inadequate, and the scleral lenses provide continuous hydration and protection, improve vision and reduce photophobia, allow eyes to open comfortably for the first time in years. So you can see a scleral lens fitted on a Stevens-Johnson syndrome patient. And cicatricial pemphigoid can be beautifully managed with scleral lenses, and often the OCP causes fibrosis and keratinization, and after systemic control, scleral lenses rehabilitate the surface. They form as a shield over the cornea and preserve the moisture and delay keratinization and enhance the vision and daily function. And this is the scleral lens fitted on over a OCP. And managing Sjogren's syndrome, and we all know that Sjogren's syndrome causes severe dryness to the eyes. They act as beautiful therapeutic lenses, maintaining hydration for longer hours. And you can add preservative-free saline along with preservative-free lubricant, and we can easily manage the Sjogren's syndrome patients. And this is a case of gelatinous drop-like corneal dystrophy. And in the next slide, we are going to see the photos, which is a genetic ocular condition. And this is a 9-year-old boy who underwent full-thickness corneal transplantation 1 year before. And both eyes have a similar appearance. And this boy was fitted with scleral lenses to protect the compromised ocular surface. And as you can see, the first pic is the corneal dystrophy, and the same eye was fitted with the scleral lens, and you can clearly see the healing of the cornea because of the scleral lens. And beyond SJS, OCP, and Sjogren's syndrome, scleral lenses can help in neurotrophic keratitis, exposure keratopathy, post-radiation dryness, and serve as liquid bandage promoting epithelial healing. And as you know that neurotrophic keratitis, they lose the sensitivity to the cornea. These can be a great shield. The scleral lenses can be a great shield. And here, the cornea is, because of the inadequate blinking, the cornea can have severe dryness, and the scleral lenses can be of great help. Oops, just a half a minute. It's almost finished. And pain and photophobia, realworld.com's pain and photophobia drop dramatically. Vision is stabilized. Patients return to normal life and work. And access and awareness is very poor. In most of the clinics and hospitals, technology has advanced, but access has not. So train more on scleral specialties, scleral specialists, and encourage collaboration with across disciplines. Educate patients early to prevent irreversible damage. And sight can be protected, comfort can return, lives can change, vision and smile restored. And they are the #1 option, as I mentioned before, for keratoconus management. Thank you very much. And that's my email.
Very nice lectures. Thank you very much. Thank you.
you.
Any questions? Any questions? I have a question.
Yes, doctor.
So what about night? You are leaving scleral lenses overnight?
Yes, it all depends on case to case. What we normally, like in severe Sjogren's disease or this thing, so we try to give a fenestrated lens to allow the oxygen to pass through. Okay, and in the worst case, like if it doesn't work, we normally give at night to sleep with silicone hydrogel soft lens with good lubrication.
So it is allowed for how long if you are going to give it full time?
Full time they can wear. We normally, if it is for 24/7, we give 2 pairs. So 1 pair for during daytime and the second pair for night time.
And you change it after?
Every year.
Every year?
Every year. Yes, doctor. And the lenses have to be cleaned with hydrogen peroxide. That works wonders.
So you can just small comment that this is this scleral lenses are saving eyes for some, but the issue of what we always say for doctors attending and for the optometrists attending, the valse dancing between the optometrists and the doctors, the valse. So don't hit the foot of each other. So when it's like that, they're like that. So here facial palsy will be definitely having very high infection and everything if you will put the scleral lens, in my opinion. So do the surgery, make the closure properly, do the things which is there is no wash. So don't push a lot over your optometrist, and
No, it
don't
has
put
to be a with complete coordination between the
but
ophthalmologist and
sometimes we are
optometrist.
lazy to go back to the theater and put it all on you and give a very bad results. And at the time, it's not a mistake of the optometrist. Actually, the decision making is very important. Not to go through, not to put a lot on something which is not going to work, because they need at least a shuttering mechanism of the lids. Thank you. Thank you.
Thank
very
you,
much.
doctor.
So the next speaker is our vision therapist.